I'm Debjani Barman from Institute of Health Management Research University, and I additionally work for Future Health Systems Research Project Consortium as well. And in that, we are working in Indian Sundarbans over the last 6 years actually. And my present study, as I titled it, are women of Indian Sundarbans living in dark, a gender analysis of eye health problem, is also based in Indian Sundarban. Sundarban is actually a UNESCO World Heritage Site, and it's the largest mangrove forest area. And it's very famous for its, rather infamous for its geographical inaccessibility. My research aim is to assess the gender role in healthcare seeking for visual impairments of 50 years and above in Indian Sundarbans. We took this particular age group because the prevalence of eye health problem is actually more once a particular person crosses age band. And method, we followed mixed method design, and we actually take help of optometrists. The picture in my title slide is actually showing two of the optometrists doing the eye examination of the study participants. We actually followed RAP methodology, rapid assessment of avoidable blindness, and following that we actually interviewed 442 individuals where we followed quantitative study techniques, and from that 442 individuals further we do in-depth interview among the 24 study participants, and we followed intersectional approach to explore how gender cross-cuts with other social determinants of health. Now the key findings. Elderly women are most likely to develop visual impairments compared to their male counterparts. We actually divided this 50 years above male and female into three groups actually: young old, middle old, and oldest old. Young old were the people who are up to the age of 64 years old. Then 65 to 74 people are termed as middle old, and 75 to above are termed as old. So the prevalence of eye health problem or the problem of visual impairments is highest among that oldest old band, and that too among the women. Among the other background characteristics, religion, family type, perceived poverty status, and employment came out as a significant predictor for developing visual impairments. And interestingly, male poor were found less likely, where female non-poor are more likely to develop eye problems. That is the beauty of actually adopting the intersectionality lens. Once I check my study findings solely by perceived poverty, it's just going to show me that the poor are more likely to get visual impairment, or I simply check my results by the gender type, whether male or female, is going to show me that female are more likely to have visual impairments. But this particular intersectionality lens actually allows me to see how gender is cross-cutting with these social stratifiers like poverty status, like age, and again like education. As my fourth major key findings is that gender and education intersection has no gender-specific leveraging factors on eye health. So whether you are educated enough or not, and gender is not playing any extra leveraging factors on eye health. And in case of elderly females, it is mostly a male member in the family who decides on her healthcare seeking behavior, whereas men decide this mostly for themselves. And this is especially true when the woman is a widow. So she is mostly, in case of in the context of Indian system, she is mostly dependent on her son. So it's the son, or if she's married, her husband, who is deciding whom to visit, when to visit, and how much to spend, and when to stop the treatment seeking actually. Implications in terms of gender analysis in health systems, as I already mentioned in my key findings, when gender cross-cuts with other social stratifiers like age, poverty, and education, were in a more vulnerable position compared to their male counterpart, both in terms of age and poverty status. So given this multi-layered nature of vulnerability, For a resilient health systems, one should take intersectional approach to ensure effective and gender equitable healthcare.